Good day. Hello to everyone who's listening us, who's coming in. I say a warm welcome to all of you. I also say a warm welcome to all our panelists. Some housekeeping informations. All of you who want to interact with us can do so by putting their questions in the Q&A section. We will start with some inputs from our panelists and then go to all your questions. Leadership is a word that you find ubiquitously. It's abundant. Interestingly, a lot of people use it. Warren Buffett is cited, as is Ravi Chaudhry in his book, A Quest for Exceptional Leadership. But today, we want to look at leadership in a pandemic. The quest for leadership has been heard much more frequently during the last 2 years than it was perhaps before. What did we mean? What were we looking for when we mentioned leadership or the lack of? And now, I think more importantly, the call for leadership for how we should progress from here. The call for leadership in difficult times is not new. The Roman writer Publius Syrus, 2000 years ago, said, anyone can lead or anyone can hold the helm when the sea is calm. Or let's say it in a less aphoristic way, leadership is easy when no problem arises, when everything is calm. It is when the waves come that the leader must use skills and influence to successfully lead the crew through rough times. And here we are with the other thing, the crew. Leadership always includes fellowship. You will hear today people who are at the forefront in pandemics in different parts of the world, and people who have been leading or are leading in leading roles and who have been followed. Let me start with our president, Professor Walter Ricciardi. He is the now president of the World Federation of Public Health Associations. We will hear from Alejandro Jadan, Canada, JeanMarie Okfobele, DRC, Rüdiger Krech, Geneva headquarters of WHO, Maria Rocia Sáenz from Costa Rica, Martin Mckee from UK, and Melissa Swick from Australia. But we start with Italy. Walter is, and I hope he excuses me, kind of a pop star in public health in Italy. He's very well known in Italy because he has so many, or he has had and still has many roles in Italy's public health. But it's easier for me to start with saying he is a professor of hygiene and public health at the Università Cattolica di Sacro Cuore a Roma. But he is also active in national health policy and is chair of the public health section of the Higher Health Council. In 2011, the Minister of Health of Italy appointed him as the representative in the State Region Committee for the evaluation of the whole Italian National Health Service. But not only in Italy, also at the EU level, you see Walter in leading roles. More recently, he accepted not vaccination, immunization now, but cancer. He is the president of the Mission Board for Cancer of the European Commission. It may be through all these different multiple tasks and roles at different levels, both nationally and internationally, that Walter had the idea of creating a leadership coalition at the World Federation of Public Health Associations. But he is best positioned to explain us now how he came across this idea and I am very happy to give you the floor. Walter, please.
Thank you very much, Bettina. I hope you can hear me well. Yes, these are interesting but challenging times. And for the first time in the history of mankind, we have experienced a new kind of epidemic and then pandemic in the times of alternative facts, fake news, important role of social media. So beyond the traditional skills and competencies that public health professionals had to have in order to tackle these challenges, we have to think about additional skills, and in particular, the ability to speak up in particular in a situation where science is marginalized, science becomes politicized and polarized. And of course, if there aren't people speaking up for the weaker, the forgotten, the people in trouble, there will be no one speaking up. And so I think it's in particular important that we speak about leadership in public health, because we have to think about the possibility not only to have natural born leaders, you know, that are brave, are able because of their history, of their education, of their experience, but we need a cohort, a group of public health leaders in order to tackle the challenges that we are living and also the future challenges. So there is a need for even a stronger leadership in public health, and now more than ever. Certainly, in order to exercise the leadership, you must have politicians who are honest, who are intellectually essentially available to speak with science. And we know that sometimes this is very difficult. But that's why it's even more important in this situation to have public health leaders that are able to speak to the people, to use the tools in order to advocate for science or for a very strong evidence-based decision-making. Take the current situation. In most of the countries in the world, now governments are desperate to satisfy the need of people to go back to normality. So they are eager to say everything that people want to be said. And this, of course, is wrong, because we know that from the sciences, this virus is cause of a new disease which is much more severe than flu. And in the current narrative, most of the governments tend to say that this now it's a little bit more than a flu, that we can go back to normality, that everything is okay, that the economy must prevail, that people can go back to their old norm. And we know that this is, of course, is not true, because the SARS-CoV-2 is here to stay, the COVID-19 is not a flu, that are countries that are struggling with the worst emergency that they have ever experienced in their history. Take the United States, for example, but now Hong Kong, and now again in Eastern Europe. So we must develop some skills in order to be able to speak in the appropriate level and to try to drive the appropriate decision, even in the most difficult situation. We have some experience in the Public Health Leadership Coalition. We have, and I thank them very much, put together some of the most important public health leaders. And we have worked together in the past year in order to share our experience and in order to transmit even to the younger and more unexperienced public health professionals in the most difficult situation that it's possible to act, that they are not alone, that there is a coalition of good willing and experience, and I hope honest people that want to work together with politicians and with people in order to take the most appropriate decisions. So that's the role of the Public Health Leadership Coalition. And we have used the COVID-19 pandemic as a kind of example to drive our experience. So I really thank all the speakers that are members of the Public Health Leadership Coalition that will bring us today their experiences, their point of view, underlining also some inconvenient truth, which is the case that we have to do in difficult times in order to transform this crisis into an opportunity. Bettina, you said that I teach at the Catholic University. I am very honored and pleased to have as my boss the Pope, because the Pope has really shown leadership in these difficult times. You know that in some parts of the world, religious leaders have played a very, very anti-scientific role, even inducing some people not to vaccinate. I still remember the image of the Pope alone in St. Peter's Square after my request in Italy not to have mass, not to have religious ceremonies. And while many bishops and cardinals arguing with me about my proposal, he stood alone in the St. Peter's Church in order to show that science and vaccination must be driving our decisions. And I hope that this image gives us the opportunity to consider this crisis as an opportunity, because there is no terrible things that waste the crisis. So thank you very much, and particular thank you to the public health leaders that are working in the Public Health Leadership Coalition and today are sharing with us their experience.
Thank you, Walter. Thank you so much. And let me go from Italy directly to Canada. So it's good morning, Alejandro Jadan. Alejandro is, for me, first and foremost of all, a philosopher. But he is also a physician, an educator, and an entrepreneur. He is the founder of the Center for Global eHealth Innovation, designed as an incubator for the future of health systems in Toronto. He holds a Doctor of Philosophy degree in Big Data and Evidence-Based Decision-Making from University of Oxford. And he created the Jadan scale, the first and widely used tool to assess quality of clinical trials in the world. But he also led a conversation on the meaning of health. So you see how broad his interests go. And this also probably led him to have very strong thoughts about the ongoing pandemic. Together with us, he has been recently publishing in the Journal of Public Health Policy a piece that is entitled "Facing Leadership That Kills." This sounds like negative leadership. Please, Alejandro, tell us more about your takes on leadership and then leadership in a pandemic. The floor is yours.
Thank you very much, Bettina. So let's focus on the meaning of leadership, and I will try to complement what has been described so far. The concept of leadership has roots that go back at least 1,200 years. And that root, which emerged in the 9th century, lead meant and continues to have a lot to do with traveling. To lead is to travel. So leadership, in essence, is an ability to persuade people, to persuade others to travel to a given destination. Okay? And to do that effectively, we basically need 4 components, 4 elements. The first one is a vision. And the best vision is one that allows people to see what otherwise was invisible. The second element that is required for effective leadership is a good story. Leaders need to tell compelling stories to the followers so they get excited and engaged in the trip that they are going to take together. It requires facts, ideally solid evidence that makes the trip credible. And above all, they need to have a coherent behavior that matches their words and their ideas, and that makes the trip feasible and possible in the heads of the followers. So that's where courage plays a very important role. Leaders need to be courageous, because to do it in hard times, as it was mentioned, is really the true test. So leadership as a concept is agnostic. It can be positive, and it's positive when everybody benefits, or when at least one group benefits, but it can also be negative. And that's what I referred to in the title of the paper, Facing Leadership That Kills, because negative leadership harms people and can weaken people, can make people vulnerable. And in the worst cases, it can kill, it can be lethal. And when we are facing existential threats like wars or climate change or pandemics, the deaths can be in the millions. So this is very serious. What we need to acknowledge is that leadership can fail and become negative because of many reasons. One of them is hubris. Leaders, and it happens very often, overestimate their ability to take the followers and to take the trip successfully. And sometimes this is mixed with two elements. One, incompetence. People don't know how to do what they need to do, or ignorance. They don't know what needs to be done or how, or they don't have knowledge about what is required. But the worst cases happen when there is criminal behavior. Leaders can get corrupt, or they were corrupt to begin with. And it happens more often than we wish that it would happen. And they put their benefit ahead of the benefit of the followers. Or they can be negligent. They may be careless and do a very bad job, even though they have the ability to do it well. Or they can go mad, or they can be psychopaths and actually harm people on purpose. They can be malicious. And we have seen big examples throughout history of that. In other cases, leadership can fail and become negative because people get tired along the way. And this is a big risk during pandemics. The destination may stop to be as attractive as it was at the beginning, or leaders and their followers may face huge complex circumstances from the outside that make it practically impossible to reach the destination or to maintain the course. Or in other cases, which I think deserve more acknowledgement, leadership can become negative or fail just because of sheer bad luck. What is common to all of these causes or sources of negative leadership is that once it happens, leadership cannot be sustained for much longer. Leadership depends on persuading people to travel in a given destination. So if people are not persuaded about the worth of the trip or the value of the destination, and they are hurt, it's very, very, very easy for leadership to vanish completely. And what happens is that a lot of leaders have enjoyed, who began in a positive way, or apparently positive way, want to hang on to power. This is a pattern that we have seen throughout history. And at that point, they need another kind of ability. And this is an ability that became very prominent during the industrial age. This is an ability that comes from a word that was used originally to describe the handling of horses. It's a word that comes from hand in Latin and in Italian or Spanish, mano. And the word is management. Management usually comes to the rescue of negative leaders, of leaders who have failed. Okay? And management doesn't require persuasion or willing followership. Management is based usually on coercion or repression, okay? Because its main goal is to get the job done, no matter what, and to ensure that people keep moving in the direction they are told, even if they don't want to do it. So what happens is that failed leadership and effective management, when they're aligned, end up hurting people much more. And one of the biggest challenges to conclude is that sadly, failed leadership that triggers effective management ends up confusing the picture for the population. So it's very easy to confuse or to use interchangeably leadership and management. We can see effective managers and we think they're leaders. The key is whether people are persuaded that what they are doing is worth doing and that they keep traveling to that destination that could be physical or mental willingly. So it can also happen, and it should happen on the positive end of the spectrum. The best picture is when positive leadership and effective management are aligned. When that happens, then leaders can focus on keeping the followers excited, motivated, keeping the vision clear, while effective managers ensure that the resources that are available get used as well as possible so that the destination can be reached in the most efficient possible way. And then, okay, the dream can happen. The dream of leadership is to create the conditions that enable people to manifest the best version of themselves. And I think that's the opportunity we have now.
Thank you, Alejandro. Thank you very much for the inspiring words and for the references to manus manum management. I didn't know, but you're right. It's the hand you put on someone. And thank you for this. Now the next person, JeanMarie Okwobele, would have loved to be with us live, but we had to pre-record him because he is on travel right now. So I asked Maria to give us the pre-recorded message of JeanMarie. Thank you so much for taking your time to record your thoughts. For me, you are an amazing, wise person. But please let me introduce you to our audience. You are a true public health person. From the very beginning on, you were born in what at that time was Belgian Congo, went to your medical school in Kinshasa, and right away, you trained as an epidemiologist. Epidemiology, one of the important pillars and tools in public health. You did that at Harvard. Yes. But for us and for what we're going to discuss today, what is far more important is that you have been into the management of infectious diseases, and you have been through different endemics and pandemics throughout your career. And this both at the national level in your country, the DRC, but later also in the UN system. So both with WHO and UNICEF, you lead programs in immunization vaccination. So for today's topic, you are a perfect authority. Please, JeanMarie, my first question, what is your take on the term leadership?
Thank you very much, Bettina. Thank you for having me in this webinar on leadership. Questioning leadership is timely to me. As we know, leadership is about change, and change must be led. Leadership can be understood in terms of arrangements and organizational processes that help doing things in the right way and do the right things. Leadership can imply or should imply bringing together on one hand the evidence and on the other, trusted expertise so that authoritative policies, decisions are made for the benefits of the public. And leadership is also about communicating on those policies that are made so that, explanations are given on reasons why, such positions are taken for, again, facilitating the understanding and the adhesion of, the people that are concerned. You talk, Bettina, you talked about, my work in Congo, and, a few times I did contribute to the control of the Ebola outbreaks that have been affecting the Congo since 1976 when, the virus was discovered. For the largest outbreak that we had in 2018, 2019, a couple of things come to mind that to me reflects the strong leadership that we saw, that led to bringing the epidemic to control. One is the creation of a task force. The task force that was led by the Minister of Health and WHO, but also as the task force associated a few other experts, the best that one could find in the country here from other organizations. And that task force met daily to provide a backup support to the teams that were deployed in the field. They truly did a superb job in constantly analyzing the situation and bringing about the recommendations that could facilitate the implementation of measures in the field. And the second thing that I saw that was critical is the production of a strategic response plan that kind of federated mobilization of support to bring the epidemic under control. The plan obviously did specify the various components that one had to deal with during such an epidemic, such as contact tracing, laboratory support in the field, communication, infection prevention and control in areas where we saw weak infrastructure, weak health systems, and many other components. Then the important thing I saw about on the plan was the fact that it was evaluated every 2 months, and this regular evaluation of the plan produced recommendations that were then incorporated in the plan. So the plan was a kind of living document, and truly that was an important way of being helpful, being up to date in terms of the implementation of the measures that were required. So these are some of the points that I could say on your point in terms of what leadership is about. Clearly, facilitating the decisions that are good enough for the benefit of the populations that are affected by epidemics or any other circumstances.
What is most needed in the current pandemic in terms of leadership?
Bettina, on your point regarding what is needed in the current pandemic, I would say first that it's important that the current leadership that we saw, the political leadership, public leadership, that they continue to be mobilized until the very end of the pandemic. We're not yet there, and hopefully, the mobilization will continue because we need it. Secondly, I think that leadership should take, very seriously the need for addressing some of the challenges, some of the weaknesses that have been seen here and there. And to me, one of them is about the lack of coordinated response. As we move hopefully towards the end of the outbreak, I think that coordination would be extremely helpful, so that the countries or block of countries could implement, the same measures that will bring under control this pandemic. It was truly difficult to see or to observe, that sometimes neighboring countries will not, get together well in terms of agreeing on the measures that can be implemented, including for people living almost in the same areas, although there is a border somewhere in between. I think what is also required now is to review some of the measures that have been taken that are completely unhelpful. There are still countries that are applying border closures. I think they should be revisited, or curfews, at certain hours, especially in the nights. And then finally, I think we need better communications on the role of vaccines at this present time. Vaccines are clearly what will help us to get out of this pandemic, in the best and the quickest way. We need very good explanations on what the vaccine can do, what they cannot do, with the first generation of vaccine that we have, and why they are needed, including in countries where, the outbreak has not been heavily seen in terms of, the way people have been affected. So my point is to say, we need at this point in time mainly to look at what is required to get, to the last lap, to get us to the last lap of the pandemic. We need to get, some of the corrections in the measures that have been taken and that are not very helpful, and clearly continue to communicate as much as one could do. Thank you.
We thank our friend JeanMarie and wish him safe travels today. And it's my pleasure to turn to Rüdiger Krech now. Rüdiger Krech is not only our person for the World Federation of Public Health Associations at the WHO, but he is far more, I would call him a friend of the World Federation. In fact, he is the director of the Health Promotion Department at WHO, headquarters in Geneva. He is probably someone who from very early on was into social security and social health systems. He joined the German Technical Corporation, where he worked as head of social protection section in India. And then he also led in 2005 a group together with ILO, International Labour Office, WHO, and the German Technical Corporation to create a consortium on social health insurances to make sure that there is more health protection coverage in developing countries. And you see that this role goes through all his CV and continues. He has had different roles at WHO, and he is the person for us who is inside the UN system. So first of all, I'm very thankful that you take your time, Rüdiger, but also I would like to ask you not only your take on leadership, but also how you would see leadership in the UN system. Thank you, Rüdiger. You have the floor.
Thank you very much, Bettina, for this kind introduction. Yeah, let me share a couple of insights on this question that you just raised. What is leadership in a pandemic from the UN system? As you can imagine, this could be a webinar series of its own. So I will perhaps concentrate on the current learning that is evolving during this pandemic. And interestingly, this learning is consistent with recommendations on the role of the UN system and WHO in particular during reviews of earlier pandemics, such as Ebola, H5N1, and H1N1. So we have those recommendations at hand for at least the past 10 years. With regard to the role of the UN in leadership during a pandemic, let me say that importantly, we have the tools available. We know what and how to be well prepared as a global community. The issue is to garner the political will to do so. And I'm very grateful to the speakers before me that have actually very nicely outlined this fact. Currently, the role of the UN and especially the functions entrusted to WHO under the international health regulations are carried out in particular through strategic health operations that provide support to countries in detection and assessment of and response to public health emergencies. So what are currently the roles of WHO within emergencies? So WHO supports the assessment of country health emergency preparedness and development of national plans to address critical capacity gaps. WHO develops strategies and capacities to prevent and control high threat infectious hazards, and WHO's monitoring of new and ongoing public health events to assess, communicate, and recommend action for public health risks. And then in addition, we as WHO work with countries and partners to ensure readiness to diminish public health risks in countries with high vulnerability. A robust chronology of events that was published by Helen Clark and others in The Lancet in November 2021 reveals very clearly the shortcomings of these international health regulations and the need for review of the functions entrusted to the World Health Organization. First of all, the IHR are insufficiently precise in several areas. They are too reactive to encourage proactive response, and they bear a risk of delaying reporting. The Member States Working Group on Strengthening WHO's Preparedness and Response to Health Emergencies analyzed the impact of WHO recommendations according to the following categories: leadership and governance, systems and tools financing, and equity. Looking across all the review panels and committees, it is worth noting that although the mandates of each as well as their methods of work were different, the recommendations are mainly consistent across their reports. Based on initial discussions of the recommendations and their applicability for strengthening WHO, as well as enhancing global preparedness and response to pandemics, the following 4 items were repeatedly highlighted by member states as priority areas, especially for leadership. So the first one is strengthening governance. Member states expressed the need to strengthen WHO's governance and member states' oversight of WHO's work in health emergencies. There is general consensus around the need to increase member state involvement in and direction of WHO's governance. The Independent Panel for Pandemic Preparedness and Response calls for an authoritative, independent WHO as an essential part of a reform package. The World Health Assembly agreed in November in 2021 to kickstart a global process to draft and negotiate a convention, an agreement, or other international instrument under the Constitution of the World Health Organization to strengthen pandemic prevention, preparedness, and response. The first meeting of the Intergovernmental Negotiating Body will be held on 1st of March. The second issue is to strengthen the international health regulations. Member states have reiterated their support for the IHR as a key component of the global health architecture. Member states expressed their support for strengthening the IHR, including through implementation, compliance, and potential targeted amendments, without reopening the entire instrument for negotiations. But let me say also that from the start of this pandemic, not all areas that are expressed in the RHR were followed by all member states. So we have a lot to learn from that as well. Then thirdly, on strengthening finance. Member states recognize the need to provide WHO with adequate and sustainable financing so that WHO can play a leading and coordinating role in global health as enshrined in the WHO's constitution. Member states also recognize the need for national investments and effective mechanisms and leadership from other actors, including the international financial institutions and existing global health institutions, in order to strengthen pandemic preparedness and response, especially in low resource countries. Let me just ask you the question, what do you think the budget of the WHO, with all its aspects, not only on emergencies, is? It is not more than the overall budget of one university hospital in the world. And nobody can tell me in the world that money would not be there to have 2, 3, or 4 hospitals to actually keep the world safe and to promote health. The fourth one is to strengthen equity. Member states agree that equity is critically important for global health, both as a principle and as an outcome, and will remain an issue of focus of the working group. Member states emphasize that equity is essential, in particular in prevention, preparedness, and response to health emergencies, with including the respect to capacity building, equitable and timely access to and distribution of medical countermeasures, and addressing barriers to timely access to and distributing measures overall, as well as related issues such as research and development, intellectual property, technology transfer, and empowering of local and regional manufacturing capacity during emergencies to discover, develop, and deliver effective medical countermeasures and other tools and technologies. And that is, in terms of leadership then, a big issue for the WHO in order how to then look at the accountability, not only the monitoring, but also at the accountability of member states to implement these measures. The member states working group on strengthening WHO's preparedness and response to health emergencies is currently assessing the relevance of the technical guidance and whether and how member states have followed this guidance. As you can imagine, we in the technical departments have developed and issued guidance with broad action and contributions from various stakeholders, civil society, academics, member states, and many more, to come up with guidance on clinical issues, on sanitary issues, but also on issues related to the provision of services to non-communicable diseases during NCDs, or how to keep schools open during a pandemic. And we will await this report, whether and how member states have followed these recommendations in due course. We expect this report, as I said, to be tabled at their next meeting in March. A final word on coordination. When emergencies occur, coordination is necessary. No one organization can respond to a health crisis alone. The Global Health Cluster is a platform for more than 900 organizations to work in partnership to ensure collective action results in a more timely, effective, and predictable response to health emergencies. And WHO is the cluster lead agency of this Global Health Cluster. So what do? They provide the right expertise at the right place at the right time. They build the capacity of health cluster coordinators, gather and disseminate sound and relevant information to guide partners' response, identify and address gaps in technical knowledge and available guidance to ensure the health response follows global best practice and standards, and finally, to promote and advocate for the importance of humanitarian health action on the global stage to help ensure that political and financial support is secured. So Bettina, here are some functions for some leadership functions that are executed by the World Health Organization. As I said, this needs to be reviewed. We believe that this is not enough to really manage, as we heard before, what manage means, a future pandemic, which we will certainly see if the root causes and the root risks for pandemics are not addressed fundamentally. And we have, while we are always hopeful, but having seen the last responses to last epidemics, we need to be cautious that this fundamental change that societies need will be really done. So therefore, we need to be prepared for something new. Thank you very much.
Thank you very much, Rüdiger, for this, and also some questions from WHO in terms of money and help, perhaps from our side. It's my pleasure now and my honor to call and to go to Costa Rica to call on my friend and colleague, Rocio. Thank you for getting up so early. Good morning, Rocio. I would like to call you an excellent female leader in both your country, Costa Rica, and Latin America. And your lens on equity and justice always impresses me. But more formally, Dr. Maria del Rocio Sáenz Madrigal served as the executive president of the Costa Rican Social Security Fund from 2014 to 17, and as a Minister of Health of Costa Rica from 2002 to 2006. Currently, she is a professor at the School of Public Health of Costa Rica, where she has different programs, both on patient navigation, on cancer in women, and a research project on primary healthcare. She is also the president of ALASAC, which means the Latin American Alliance for Global Health, as well as the Network for Health Equity in the Americas. Rocio, thank you so much for being here with us for you early in the morning. And I would like to listen to your takes on leadership and leadership in a pandemic. Thank you, Rocio. Your turn.
Good morning, and thank you for your invitation to be part of this panel. It's a pleasure to be the first woman to speak. Yes. For me, it's very grateful to talk to you about my lesson learning, my work, everything that this moment and this time of the world give us as humanity. I want to start especially to take some ideas about that the social inequalities within and between the countries of the American region are historical and were revealed to the whole world during these 2 years of the pandemic, filling with suffering, desolation, and uncertainty about the future. Not only because of the pandemic itself, but due to the worsening of the inequalities. The population also silent demands the comprehensive approach for the crisis. In our region, and in the case of Costa Rica specifically, the leadership in health was characterized by harmonization, the intersectorial multi-level health response, and with emphasis on institutional and hospital epidemiologic preparation. However, it was striking not only in Costa Rica, the little emphasis on linking local governments and organized community groups, rather with restrict message and somewhat blaming oneself for getting sick or making others sick. This approach positioned predominantly the local and global context, the paradigm of the unicausality. That leads to focus monothematic and partial social response to the reality that is complex and that we have to live in this year, with indirect effects in the suspension of the care of chronic disease and routine procedure, and physical and emotional burden of the hospital teams, and fear of the population to be infected in the health facility and to die alone or with strangers. Being a leader, continue with the Alex thoughts, being is important, for instance, and for my own experience, having the social, legal, and capacity legitimacy to do what? Identify the magnitude, the complexity, the severity of the situation, organize the response, retrieve the scientific and empirical evidence, set the priorities. But for the most important for me is to build the consensus. How to build the vision and how to build the consensus to go to this travel. How we can transform the situation. Can we do it? Or at least we only try to keep the situation as was before the pandemic. And for me, this is the very important issue to hear here. And also have the system for the transparency, effective use of the resources, and strengthen the democratic mechanism to accountability to the citizens. All of those is very important, especially all over the world, but also more in our region. What the region saw us is that the leadership health must include equity in the design and implementation of the action. Otherwise, the results will be partial, insufficient, unwinding, or maintain the gaps in social inequalities between the different population groups. And for me, this is the most strongest lesson learned, the way we can share, take from our region, but also share globally.
Thank you so much, Rocio. Yes, indeed. It's not our topic today, but in another webinar, we will talk about perhaps female leadership. It is now my turn to get us from Costa Rica to the UK. And yes, Martin, please excuse me, but for me, you are the dynamo, the turbo of global public health. You're always into minimum 5 different projects. When I meet you, you're doing things like in parallel, multitasking is your thing, while you are in the same time tweeting of the activities you have. Incredible. And in a more serious way, I have to introduce you perhaps by saying Martin Mckee has created the European Center on Health of Societies and Transition in 1997, when the Berlin Wall broke down and the Soviet Union split apart. And so he has been thinking about transitions very early on and researching. A lot of his research focused on these questions. Now we are probably again in a transition phase. But among all the other roles that Martin, you're taking on, you are also research director of the European Observatory on Health Systems and Policies. And so you have a very, very sharp view on European health systems and even more sharply on your own country, UK. those who have followed you have seen how much you comment on Brexit, but also on the pandemic policies in your country. And in the current pandemic, political leadership of your country has been in your tweets. Now, what is your take on our question? The floor is yours, Martin.
Thank you very much indeed, Bettina. Well, we warned them, didn't we? For years, many of us have been doing what we could to draw attention to the risk of another pandemic. History was our guide because from the dawn of recorded history, we've had outbreaks of infectious disease that have had huge implications for the societies in which we live. They included the plague of Athens, which paved the way for the rise of Macedonia and Alexander the Great's conquest. And then we had the Black Death of 1348, which transformed European society, or the decimation of the Native American population after the Columbian conquest. Well, thankfully, the damage done by COVID has been nothing like as great. We now have an unprecedented level of scientific expertise to draw on. Who could have imagined that we would be able to deploy new vaccines using an entirely innovative technology within a year? But next time, we might not be so lucky. Now, of course, it is easy to blame our political leaders. It was the misfortune of some countries, including the one that I live in, to be led by some of the most incompetent politicians in their history. As a former senior politician in his own party said recently, if Boris Johnson tells the truth, it is likely to be by accident. And I'm not even going to begin to think about the consequences of Donald Trump's presidency. But maybe we need to accept some responsibility ourselves. Once again, we in the health community have been left to pick up the pieces of political failures. We were the ones who were there when a crisis emerged. We were expected to use our limited resources to care for large and unpredictable numbers of patients needing our care. Working in public health departments that had been ignored for so long, we were expected to mobilize on a massive scale to slow the spread of disease. Our task was made so much harder by the vulnerabilities of our populations, people who were left behind by a decade of austerity, whose precarious employment is an inevitable consequence of the economic model that our governments have pursued. Now, throughout the pandemic, I've often wondered whether we've lost our way. We've acquiesced when politicians dithered and delayed, or worse, have done things that we knew were wrong and would cost lives. We've clung to the mantra that science is science and politics is something else. Yet we in the public health community, of all people, know that this is nonsense. Even the decision about what to research is political. Do we focus on the educational interventions to change behavior that we, and importantly, the manufacturers of harmful substances, know are ineffective, rather than studying the social and commercial determinants of health? Do we emphasize individual responsibility when we know that even when people make choices, they don't always do it in the circumstances of their own choosing? Or do we study the difficult issues, like political corruption, of which we have seen so much during the pandemic, especially in relation to the procurement of PPE, or racism? Many of our illustrious predecessors would also wonder. Now, you know, I often quote Rudolf Virchow, the pathologist tasked with responding to the typhus epidemic in Silesia in the 19th century. He was clear where the problem lay. It was the power of the aristocracy propped up by the church. But who among us is willing to call out the dysfunctional electoral college that gave us Donald Trump? Because ultimately that was why so many Americans had their lives cut short unnecessarily. Now, of course, you may well say, it's all right for me to go on about leadership. What have I done? Well, certainly much less than I should have, but at least I've tried. Throughout the pandemic, I and a group of remarkable colleagues have been providing an alternative perspective on the UK's management of the pandemic, called Independent SAGE to distinguish ourselves from the official advisory structure, although I don't think we've ever disagreed with the scientists advising the government. We've been able to challenge ministers when they failed to follow the science. And we've given voice to the many people whose concerns have been unheard. In brief, we've spoken truth to power, perhaps the most important of all public health responsibilities. But we need to do more. For over a year, I was a member of the Pan-European Commission on Health and Sustainable Development, chaired by former Italian Prime Minister Mario Monti, and I was glad to have Walter with me on that. I also chaired its Scientific Advisory Board and led the writing of the evidence review. And this experience taught me something very important. Most of my fellow commissioners were from outside health. We had 2 former prime ministers and 3 former presidents. We had people from central banks and from the world of finance. But what united them was that they really cared about health. They realized that we had got things wrong. And they also knew that we could not make the same mistakes again. Above all, they displayed an ambition that is all too often lacking in our approach to the big questions. These are people who are used to getting things done. So we came up with some radical suggestions. We need to change our relationship with animals and the natural environment. We need an approach based on One Health, which confronts issues like loss of biodiversity and climate change, and powerful vested interests, such as those involved in factory farming, so that we can reduce the risk of another pandemic microorganism emerging. We need to change the discourse. A government that fails to invest in its health system is being reckless. In the past, the international financial institutions might have congratulated it, seeing it as good budgetary discipline. That has to change. All it is doing is increasing the risks it would face in another pandemic. And we need to confront policy failures in other areas. We cannot simply sit back and clean up the problems created by our political leaders with economic and welfare policies that leave so many vulnerable. And this means that we must talk directly to heads of government. Let's face it, in most governments, the health portfolio is what you give to the most junior minister or to the minority party in a coalition. We talk about health in all policies, but do we do anything about it? And yes, this means that we do have to get political, not by tying ourselves to a particular political party, but by confronting the political determinants of health. Otherwise, we are guilty of abdicating the leadership that we look to in others. And if we don't do this, then we need to ask ourselves why we bother getting out of bed in the morning. Thank you very much.
Thank you so much, Martin. And yes, we both share this love for historical references. Thank you also for those. And it is now my pleasure to turn to the last person on our panel. That is Melissa Sweet from Australia. In fact, I asked Melissa to leave her role as a journalist, where she herself is asked to moderate and to change and to come up and give her views. Melissa leads the Croquis Social Journalism and works as a public health journalist, I would say. She completed a PhD at the University of Canberra. Interestingly, I will say the title, it was on the incarceration in health facilities of Indigenous Aboriginal people. So she also has a focus on the ones that are neglected by our systems. And it is for me the possibility to give her a special question. The question is, during the pandemic, we have been talking about the role of media, the classical media, but also the social media. And I would like to have your views on the fact, should media take up a leadership role in a pandemic? Melissa, first of all, thank you for staying with us late in the evening, and thank you for sharing your thoughts with us. Melissa, the floor is yours.
Thank you very much, Bettina. And I hope my internet remains stable. I just dropped out a moment ago, so please send me a signal if I'm not clear. I would like to begin by acknowledging that I'm speaking to you from the country of the Malakadi people in southern Lutruwita or Tasmania, which is a constellation of islands in the south from mainland Australia. I pay my respects to Aboriginal and Torres Strait Islander people's leadership at Croaky Health Media and more widely in working for better health for communities and in caring for country for many tens of thousands of years. So that's leadership going back many, many generations. I also pay my respect to all First Nations people participating in this webinar and to the other panelists, and thank you to the organisers for the opportunity to participate. I may have taken the question slightly differently from how you intended, Bettina, so my apologies if that's the case. I thought I would approach the topic from the perspective of a public health journalist and what I have observed and valued in leadership for public health, which is an important distinction from public health leadership. One implies leadership that can be owned by the community, and the other implies a profession, discipline, or institution is owning the leadership. I think of leadership as an attribute of nations, governments, systems, organisations and institutions, communities and people, whether they be politicians, health professionals, researchers, parents, teachers, or other community members. As a journalist, I've been trained to always ask the questions: who, what, when, how, and why. And I think these are useful also for interrogating leadership as they are for anything else. First of all, who is leading and for whom? Why are they leading? And this question can, of course, always be answered at multiple levels. Where are they leading? This could be geographic or metaphorical, as Alex was speaking of the journey. What are they leading? Is it a response to the pandemic? Or is it a response to the climate crisis? Or is it a response to growing inequality? And hopefully it is all of the above. And when? What is the time frame that leaders are thinking of? Are they thinking of their responsibilities to future generations? And that's where I, again, as a non-Indigenous person, look to the leadership of Indigenous people who are so good at thinking generations ahead. I also, when I was trying to think about what I've observed about leadership as a public health journalist, I found it much easier, I must confess, to consider what leadership for public health is not. So it is not unrepresentative. So it represents the community it is serving. And more than that, it privileges the voices of priority populations in its structures as well as its work. It is not promoting racist, gendered, and inequitable responses, as we've seen in so many places. It does not display a lack of understanding or concern for health equity. It is leadership that recognises that treating everyone the same will worsen inequities. And Bettina, I liked your image of the boat in the storm. And that's a metaphor that, you know, we've probably all seen used many times in memes that to explain health equity and the pandemic, that we're all in the same storm, but we're not all in the same boat. So leadership for public health is not siloed. It's not considering issues in isolation. It sees that pandemic disruption can be an opportunity for addressing other public health concerns. It engages with complexity. It is not appealing to populism. It is not ignoring, spinning, or misrepresenting public health evidence. It is not prioritising politics and vested interests over people's lives and well-being. It is not failing to acknowledge and learn from mistakes and changing evidence. I think it was easier for me to think of what public health leadership is not, because we've all seen so many examples of what it is not. On the other hand, Leadership that is for public health inspires trust, is accountable and transparent, as Rocio mentioned, and really values effective communications and equitable communications. So often we've seen communications that are one size fits all and really not tailored for the needs of diverse communities or audiences. Other qualities of effective leadership: values driven. We speak a lot about evidence, but I really think values are so important. And I think it was Alex who mentioned courage to challenge and disrupt power. As Martin said, speaking truth to power. Hopefully that is disrupting and challenging power in itself, but probably we need much more than that as well. Authentic voice. I think great leaders really are speaking from the heart, from who they are. They know who they are. And I think that goes to Alex's storytelling as well. There's a world of difference from stories that are authentic versus those that are manufactured. Other qualities I think of are the capacity for reflexive listening and self-awareness in terms of understanding one's own position and capacity and flaws. Beyond all this, it is about showing up and doing the work. As Rudy said, it also needs to be properly resourced and supported. And I think of one of my dear colleagues, Dr. Janine Mohammed, the CEO of the Lowitja Institute in Australia, who once told me, leaders always eat last. And I think that's such a powerful metaphor, going back to valuing other species as well. She was saying that in terms of packs of animals. As for leadership in the media, that is a whole other story. There is no one media, especially in this digital age. In many places, and I don't pretend to understand media systems in other countries, but in many places, the media ecosystem is dominated by powerful corporates, whether we're thinking of Meta, Google, or Rupert Murdoch's empire. I prefer to talk about leadership in public interest journalism than media, which I think aligns more usefully with public health. In fact, at Croaky, we practice public interest journalism as a multidisciplinary team effort, which includes many public health professionals. I'm not sure whether public interest journalism is a discipline of public health or whether public health is a discipline of public interest journalism. We do advocate a lot at Croaky for public interest journalism to be understood as an important social determinant of health. Public interest journalism is under threat in many countries. In many countries during the pandemic, journalism has become an even more dangerous job. And as so many other sectors have also experienced, the pandemic has undermined the viability of many news organisations, just at a time when our roles, especially around communications, engagement and accountability, are so important. I acknowledge too that our industry has too often contributed to the spread of misinformation and disinformation and undermined leadership for public health. And just to end, I know many of you from Twitter, where I do share a lot of information, and two hashtags that I recommend for people who are interested in media and public health leadership. One is hashtag regulate digital platforms. I think it is such an important issue in terms of being a very underlying determinant of so many of our health concerns, including the rise of populism, attacks on science that you've mentioned, the polarization of societies. And the other hashtag that I would recommend to you is hashtag PIJ Matters, Public Interest Journalism, PIJ Matters. And that's looking at trends in public interest journalism, often through the lens of public health. So thank you very much.
Thank you. Thank you so much, Melissa, for calling on public interest journalism. I think it's important and crucial that you made the distinction between some of the media that are powerhouses and public interest journalism. And thank you also for the two references and the hashtags that probably people will go on and follow from now on. Before I open up to questions from the audience, I would like, first of all, to thank you all for having prepared so interesting and thoughtful contributions. It gave me a lot of notes here, but I would like to see if among the panelists, there's someone who would like to add something or to ask another panelist for what he has or she has said.
Maybe I can add that there is another important work carried out behind the scenes, which is the work of strengthening WHO and working in the direction of the Global Pandemic Treaty. And I think that the role of public health leaders should be to support this process and to speed up it, because it's even in the best possible scenario that won't succeed before 2024. And everything can happen until that date, so we have to be able to speed up the process. And another important action that we have to support is the leverage of patent for global vaccination that it's even not yet discussed in the current rules of WTO. It's very difficult and leaves the doors open to new variants and to the danger of having variants that are more dangerous than the current one. So I think that these are two other scenarios that have to see the involvement, the active involvement of public health professionals worldwide.
Thank you, Walter. Is there another panelist who would like to add? I think that the pandemic treaty, and that goes back to things that Rüdiger said, is probably part of the things we can do ourselves from our governments and from our own positions. I see Martin has his hand up. Martin, please.
Yeah, thanks. I think one of the things that we do need to do is to confront this issue of national sovereignty. Now, obviously, that's something that's been talked a lot about in the United Kingdom recently, but the reality of it is that all of our countries have responsibilities to others. And we've been in a situation where countries that have actually managed the pandemic really well have then had the problems of cases being imported from other countries that have not done so. And we've also had the problem that we as a human race have been looking with horror at our fellow human beings in other countries that have had the misfortune to be governed by politicians that have allowed have failed to respond to the pandemic. So in the same way that the world has come together in the past to tackle issues like nuclear weapons, chemical weapons, things like that, counterfeit banknotes, maybe we need to start challenging this idea that what happens within the borders of a country is only a matter for itself in terms of health. And that will mean that countries that refuse to collect data and to report data on what's happening, and there are countries that do that, will have to answer for it in an international forum. It will involve giving WHO more teeth. But of course, the difficulty there, and of course, the proposals in the intergovernmental panel or the international panel are quite important here, in that the Director General would only have one term of 7 years, so they wouldn't be worrying about re-election. I think that would be an important issue to give you that independence. But that would mean that WHO would have to confront countries whenever they fail to live up to their obligations. So we really can't go back to where we were before. We've got to learn the lessons. And that means that we just do more than pay lip service to this idea that microorganisms do not respect national borders. They don't. And the policies must also take account of that.
Thank you, Martin. I see that Rocio has her hand up. Is it right, Rocio?
Yes, thank you. I want to keep one idea that all of us was talking about, the complexity. If we are talking about the pandemic, it's a complexity situation in a complex world. Of course, we as professionals, as social society, United Nations, as a professionals, people has to really work together and really build this consensus to really bring the approach, the for this complexity, the comprehensive approach. And for that, I think that the treaty, talking about the vaccine, the equity, the information since the community through the global level, from the global level to the communities is very important. Keep this flow clear, opportunity to really change the situation is one of the big challenge that we face in the next couple of months. To go to the treaty and to really keep working and put in the mind the importance of the solidarity, the global solidarity. It's not only the solidarity between the countries, we have to really move to more equity and more justice for all the people from Latin America, Africa, United States, Europe, Australia, wherever. Everyone account.
Oh, thank you, Rocio. Thank you very much. And I will turn to the question and answers section. And I'll start with the one, sorry for the first one, Marina, will come back to you, but someone who is anonymous, but who expresses a feeling more, talking about vaccine inequity and the fact that they feel so powerless, and asks that we feel powerless and we feel the inability to effect political change. Is there anything we can do? And this anonymous question, I think, also ask about compassionate leadership. I would like to see who of you could answer to this feeling of being powerless. Perhaps Alejandro?
Yes, thank you, Bettina. And what if is a question that has been brewing in my mind, listening to issues of equity, border restrictions in terms of thinking of action and all that. What if we are missing something more fundamental? Because we could almost replace pandemics with climate change or injustice, or we seem unable to deal with these existential threats as a species. And I wonder if this group could enable, and those who are participating, a conversation that at the same time, what we are trying to contain and prevent more damage from the current virus and its implications, we could be thinking about human nature. What's happening? What if we have exceeded our capacity to respond as a species? Okay? What if we have something built in our nature, okay, that makes us more prone to self-harm? What if there is nothing that we could do to change the course of the journey in which we find ourselves, and what we require is something different to ensure that the species gets the best possible deal? What if bugs are winning? I mean, antibiotic resistance, we could be saying exactly the same thing, okay, about almost all the issues we discussed today in terms of another threat that is going to be hitting us very hard. So I want basically to respond by using the opportunity of vaccine inequity to invite us to consider the possibility of being missing something more fundamental that requires more attention than the manifestations that we are trying to handle in a more symptomatic way.
Thank you, Alejandro. And I see that Rüdiger has its hand up, but I would also like to introduce the question of, or the comment of Marina Yamuna. She comes up with a thoughts of JeanMarie by saying we need a correction and an adjustment on our health systems and existing programs. But I see the first of us who had his hand up was Rüdiger. Rüdiger, your turn, please.
Yeah, thank you very much. And to come back to the issue of control and whether or not we're powerful or powerless. I think many of us have had it with this pandemic and with the other crises that we're in. The environmental crisis, and Alex, you said it, one could sometimes exchange those crises, and we all feel that control is taken away from us, right? So there's something happening in far China that has huge impacts on my daily life for over 2 years and continuing. So what can I do? And exactly, I think that's a key question for health promotion, because it's all about enabling people to take control over and to improve their health. This taking control, I think, is absolutely decisive. And Martin, I totally agree with you. It is not about national interests. It's not about sovereignty of national states. What we see in this pandemic is that there are no borders, but it also is a litmus test for all of us, whether or not we're empowered and we're using the powers and the impact that we have on our societies. Are we able to design societies which are based on values, which are based perhaps on well-being, which are actually addressing the core, the fundamental risks for future pandemics? And it will depend on us in public health, on us in leadership in public health, to actually create those conditions for people to take that control back over their own health and lives. And that's, I think, speaking truth to power is one aspect of it, and there's many, many more. And we need, as public health, to be much more outspoken that this is a final, I would say, wake-up call before perhaps another much more severe pandemic will actually affect us. Because if we're not now understanding the root causes for crises, for pandemics, and for other crises, the impacts of those crises on our lives and health will be even more. So a huge wake-up call for us, if I hope we will all hear it.
Thank you, Rüdiger, for the one who asked about the powerless feeling. I see, and I hope I follow the order of hands that have been raised. Martin, I think you were the next.
Yeah, thanks. I wanted to respond to the comment about compassionate leadership, because I think one of the things that we often fail to remember, as you know, I'm an epidemiologist like many of us here, and we deal with numbers, we deal with very large numbers, but we need to always remember that behind every one of those numbers is a real person. Now, we've seen some really quite shocking statements come out from some people in our own community, in the health professions. I mean, underplaying the importance of, talking about the only children that have died have had underlying conditions. Well, they're still children. It's only the old that die, that sort of thing, almost like eugenic statements that have come out, and a lack of compassion in the pandemic, quite outrageous from some people in public health and the health professionals, which I think we really need to stand up to, because everyone's life is valuable. Everyone's life must be respected. And I think we've lost touch with that. And that is where I think we need to stop dismissing evidence as anecdotal. We need to stop dismissing qualitative research. We need to listen to people who are affected by the policies that we implement. One of the biggest failures in the United Kingdom all the way through, and it's affected all of the things that we've got wrong. We've got a few things right. The science has been great, but much of the rest of it has been catastrophic. But the reason for all of that is that nobody actually listened to the people who were affected. On the front line, the teachers, the health professionals, the public health teams, and others.
Thank you. Thank you, Martin. And I think the next one was if I'm correct, Walter and then Melissa, or the other way around.
Yeah, I would like to say
Walter.
something about vaccine inequity as a dismal failure of leadership and what we can do. I think we can really do something important. First of all, speaking up, continuing to speak about this, and also linking, particularly in the Western world, the result of this inequity to what is currently happening here. So when the WTO canceled the meeting for discussing these, and because of Omicron, and doesn't even organize a virtual meeting to discuss it, we have to speak up and say, you must be crazy. You know, that's exactly the time to discuss these. And we as a public health people must do that. Because of course, if we don't do that, nobody's going to do that. So I think that this, of course, can have limited impact, but I think it's our role. So I really want to echo what Martin, Alex, and Rudiger, and Rocio, and Melissa say. So we have to continue to speak up and try to link certain phenomenon with what is existing and is happening in other parts of the world. I think this is our role.
Thank you. Thank you, Walter. And I give the word to Melissa, who has her hand raised, right?
Thank you. I was just really nodding furiously during your comments there, Martin, because they really ring true. And I think that goes to the importance of working in partnership with affected communities and people. And, you know, just tonight at Croaky, we published an article where we're facing exactly those issues you described, people really downplaying the impact. Oh, they had underlying conditions. Oh, you know, they were old. And that's how it's being reported unquestioningly by the media. And I have to say it is public health officials as well as politicians who are using that framing as well. And so our story is really just providing a platform for people with disabilities, for people, cancer patients and others, you know, to talk about what it means to them to be, quotes, living with COVID. So I just think that's so important, providing, you know, that public health leaders and organisations provide those platforms for those stories from the communities who are most affected. Yeah. And that goes to vaccine equity issues as well.
So thank you very much. Thank you also for Carol and Leah Harris, who have made comments in the chat that we will record. But I think we have our time over, and I would like to stick to the time because it is 2:30. I see that now we are completely into discussing all and everything. I hope that for those who followed us, there is a possibility to continue this discussion and to see more of these questions, that you had food for thought. And please, all who have listened, please come back to us, come back to me. We can link you up with panelists and we will see how we continue this important discussion. I would like to thank very much all our panelists for having taken the time, for being with us early in the morning, late in the evening, and sharing and preparing their views. I would like to thank the audience, thank them very much for being there. And please, audience, come back to us. If we never have finished this discussion, but I hope we could start some thoughts. It is my honor to have had you as panelists. It's my honor to have had you as audience. And I would like to conclude here and say goodbye to everyone. A big thank you. And we will continue to work on leadership. Thank you to everyone and goodbye.
Thank you.